3 more times, okay. When you hear the word Botox, what's the first thing that comes to mind? For many of you, you probably thought of a cosmetic procedure. However, Botox has more to it than just plumping lips. Botox can have a positive effect on many people, and we should be aware of the different medical benefits that it can offer the human body. Although I'm not a practicing physician myself, I do believe that I have the credibility to discuss this topic because of the research I have done and the courses that I have taken. Botox has different medical uses that can benefit the human body in different ways. Today, I would like to discuss 3 of those medical uses with you. First, cosmetic use. Second, for pain management. And third, for post-stroke recovery. First, let's talk about cosmetic use. According to medical news today, Botox is predominantly used as treatment to reduce the appearance of facial wrinkles. Wrinkles are caused when the muscles in the face contract. A more in-depth explanation of this process is, in order for the wrinkles to form, a neurotransmitter called acetylcholine attaches to the muscle in the face. This neurotransmitter causes the muscle in the face to contract, therefore causing wrinkles. When Botox is applied, it prevents the acetylcholine from attaching to the muscle, therefore preventing the wrinkles that form. As of now, Botox injections are temporary, and patients must return to the doctor's office to have them reapplied. However, in the future, maybe medical research will have a more permanent solution to prevent wrinkles entirely. Now that we've talked about some of the cosmetic uses of Botox, let's discuss pain management. The diagnosis of a painful muscle syndrome can be difficult for anybody to grasp. But there are different options to manage the path that do not involve harmful opiates. Although the use for pain management may not be completely understood, treatments for conditions such as myofascial pain syndrome can be managed with Botox. According to Dr. Heather Davis, injecting muscles with Botox has been reported to be effective in myofascial pain syndrome caused by trigger points. For example, if I have a pain in my shoulder, by pressing this trigger point, it may cause pain in my back or in my knee. However, when Botox is injected in my shoulder, it will prevent the pain caused in my back or my knee. Think about it. If pain can be managed with medical injections, the amount of people being prescribed harmful and highly addictive opiates can be dramatically reduced. So, now that we have discussed cosmetic use and pain management, let's discuss post-stroke recovery. Has anybody you ever know had a stroke? Maybe you've heard of the horror stories of how damaging strokes can be. Journalist Pat Hagan mentions scientists have discovered that in small doses, Botox can help stroke victims regain control of their hands and arms. After a stroke, many patients experience limb spasticity, which causes the limbs to spaz out. Similar to how Botox works with facial wrinkles, the same process occurs. Botox prevents the acetylcholine from attaching to the muscle, preventing it to spaz out, therefore allowing the patients to have control over their extremities. However stroke may relate to you, Botox is a new method that can help victims with their already difficult recovery. Now in closing, you have learned about the many uses of Botox and what benefits it can offer. Botox has multiple medical uses that can advance the human body. Whether it be for cosmetic use, pain management, or post-stroke recovery, Botox can definitely be of assistance. As medical research continues, more advances will be made, and maybe Botox will be able to help even more people like you and me.
Oh, that's it. Okay.
This is audience member number 1, audience member number 2, and audience member number 3.